Hello, everyone. I'm Sandra Arevalo, and I'm the Director of Community Health at Montefiore Nyack Hospital, and this is Community Chats. We're very happy to have you here today. We're going to be talking about cervical health. There have been a lot of advancements lately regarding this topic. And I think that before there used to be a lot of women who had cervical cancer and might have not survived it. But now, thanks to the science and research, I think that situation has changed a little bit. And for that reason, today on the phone, we're going to be talking to Dr. Parra. He's one of our OBGYNs here from Highland Medical. So how are you, Dr. Parra? Thank you so much for being here.
My pleasure. Good afternoon. Thank you so much for having me. I apologize that I cannot turn on my camera at this moment, but I will explain to the best of my abilities everything that we need to know in the communities about pap smears, what do we do in the office, and answer any questions that anybody could have.
And thank you for saying that, because we most definitely want to have a lot of questions. So I'm going to invite all of our attendees to please use the chat, use the Q&A that you see at the bottom of your screen, and start sending us your questions. I know that this is a delicate topic, but we're lucky enough that we have a doctor here, and he's a specialist, he's an expert. So whatever questions we have, this is the time to make them. So, Dr. Parra, I have a few questions obviously prepared for you. First of all, I want to start from the right side of things. So what is cervical health? What does it mean to have a healthy cervix?
Right. So the cervix is it's very important throughout the life of a woman, even in reproductive age and in postmenopausal age. The cervix can have many different problems. There can be infections, there can be inflammation, there can be abnormal cells or precancerous lesions, and of course, cancers or malignant lesions. So cervical health involves everything in throughout the lives of the person, including from non-malignant entities to malignant entities. So it is important for every patient to see their gynecologist. The recommendation is once a year to go to see the gynecologist to make sure everything is okay. Now, we'll talk about later about the cervical cancer screening guidelines, and we will see that we actually don't have to do that every single year. But the patient still needs to come to the doctor for an exam and make sure that everything looks normal, that there isn't any signs of inflammation, that there isn't any signs of infections, so that we can have a healthy cervix. Can you hear me, Sandra?
Yes, I hear you. I'm sorry, I was on mute. So I was asking.
I need Sandra.
Yes.
I need 1 second.
Go ahead.
Because I was pulled over.
You were pulled over?
By a police officer, yes. So I'm going to mute myself for a second and talk to the officer. I'll be right back.
Okay. Well, that's a new one for us in community chats. So in the meantime, if you have any questions, why don't you start writing them in the chat? And yeah, I see that someone has a question. So please use the chat, the Q&A. Make me hear your questions. Or not here. I'll read your questions. And I'm, of course, going to read your questions to Dr. Parra. And hopefully he's not in any trouble.
Okay, sorry about that. So if we can go ahead with the next question while I get my ticket. It's okay.
Why are you gonna get a ticket? We're just speeding.
I think you're muted again.
No, I'm not. You're not hearing me?
Hello?
I'm not.
Okay, got you. Now I can
Okay,
hear you.
perfect. Okay, so let's continue. I was asking, you just said inflammations, you said infections. So what else can you find out when we do a pap smear? Can you dig a little deeper into it, please?
Yes. So, just talking about pap smear, right? It is important to know what it is. I have a lot of patients, and I have the habit to ask my patients when they come to the office if they know what is a pap smear, especially if they're coming to the GYN for the first time. So, a lot of patients oftentimes don't know what is a pap smear for. They usually say it's just to make sure everything is okay. But that is not the case, and I usually explain them what's going on. One second, please. So I explain to every patient the pap smear is a cervical cancer screening. It is not just a test to make sure everything is okay. It is not just a test to check for STD. We can even not check for STD sometimes with a pap smear, but sometimes we can, with different orders and different labs, we can do that. So it is important to understand it is a cervical cancer screening. Throughout the life of a woman, they are going to have certain screening tests. Cervical cancer is early detection for cervical cancer. A mammogram is a test for early detection of breast cancer, and a colonoscopy is a test for early detection of colon cancer. And the pap smear is the one that starts the soonest. It starts as early as 21 years old. And in certain circumstances or special circumstances, it starts a little sooner. Maybe even when the patient becomes sexually active, if she has any problems with her immune system, such as HIV, for example. So that would be the number one thing that everybody needs to know. A pap smear is a test for early detection of cervical cancer, or how we say in medical terms, is a screening for cervical cancer.
Okay.
Um, and the results, of course, can vary. We like normal results. What the pap smear is looking at is cells from the cervix. We use a little brush to brush some superficial cells from the cervix, and this goes to the lab, and they take a look at it under the microscope, and they are looking to see whether the cells look normal, or they have low grade abnormalities, or whether they have high grade abnormalities. So the patient just tells us, what is your risk of having cervical cancer? Under 30 years of age, we typically only check for how the cells look like, which is called cytology. And the current recommendations after 30 years, we are recommended to add the HPV testing as well, which eventually is going to become very, very important. How 30 years old is the age. Sometimes pap smears also can pick up things, for example, like yeast infection or other infections like chlamydia and gonorrhea, if it is ordered by the provider.
What are some of the warning signs of cervical cancer? Is there any way that we know, or it presents in a certain way that can alert us? I think we just lost Dr. Parra.
Hello? Did I lose
Yes.
you?
No, you're back. Yeah.
I'm sorry. So what was the next question?
Any signs, any signs that we might have cervical cancer? Of course, we want to do the pap smear, but are there any signs that we can look at and make us aware that it's time to have a test done pretty soon?
So typically when a patient already has cervical cancer, and it might be maybe a little too late at that point, but they usually present with vaginal bleeding, painless vaginal bleeding, unrelated to the patient's menstrual cycle, perhaps even with intercourse as well. So vaginal bleeding is definitely one of the things or the symptoms that a patient may look up for if we're concerned about cervical cancer.
Mhm.
But typically usually no other symptoms, usually no pain. Again, and we have those symptoms is usually already an advanced case of cancer. In the early stages, when there are only abnormal cells on the pap smear, or maybe perhaps abnormal biopsies, usually the patients are asymptomatic. They don't feel any symptoms at all.
Mhm. And what will be the treatment for cervical cancer? Do you need to have surgery, or is it radiation, chemotherapy? Can you talk to us a little bit about that?
Of course. So to make a diagnosis of cervical cancer, even before we go there, we have to do a colposcopy. That is the way that we diagnose an abnormal lesion or cancer. So the first step is to do the pap smear. When we have an abnormal pap smear, and depending on the particular result, most of the times the recommendation is to do a colposcopy. We do colposcopies in the office. The colposcopies are it's a procedure where we look at the cervix with a little bit more detail, and we use a machine that we have in the office. It's called colposcope, that has some lenses, some magnifying glasses, so that we can take a look at the cervix in more detail. And then if we see abnormal cells or abnormal lesions, then we go ahead and biopsy that. So that would be our next step. So first step is the pap smear. Next step is the colposcopy, and then the colposcopy can also have pre-malignant lesions or cancer. The pre-malignant lesions we can remove in the with a procedure that is called loop electrosurgical excision procedure, or LEEP, that we could do in the office. And also there is a more thorough procedure that is called cold knife cone, that we can do in the hospital.
Mhm.
And then we continue to follow up. Sometimes the result of the colposcopy with the biopsies are cancer, and sometimes the excisional procedures with LEEP or cold knife cones then come back as pre-malignant lesions or cancer. When we have a diagnosis of a pre-malignant lesion, we can take care of those as a generalist gynecologist. As general gynecologists, we're able and we're trained to treat those lesions and monitor the patient. But when we have a patient with a diagnosis of cervical cancer, she needs to be referred to a gynecologist, oncologist for more evaluation. It's going to depend, the treatment of cervical cancer depends on a few factors. One of the factors is the patient's fertility. Has she completed childbearing? Does this patient wants to have more children or not? And also the stage of the cancer that was diagnosed. So at that point is where the gynecologist, oncologist is going to become very important in the management of the patients. Most of the time, the treatment is a hysterectomy. So the uterus is removed with the cervix if the patient has completed childbearing. And depending on the pathology of the hysterectomy, then they will recommend further radiotherapy, usually radiotherapy.
Mhm. How long does this cancer take to grow? We know that there are different stages, and of course, we want to get it diagnosed early. But if you go undiagnosed, how long does it take to go, from like a stage 1 to a stage 4? And can you talk a little bit about those stages?
Right. So with when we have a patient with an pre-malignant lesion, right? It can take several years, sometimes 5 to 10 years, for a pre-malignant lesion to become a cancerous lesion. But once that lesion, it can progress very rapidly. from stage 1, which is localized to the cervix, to stage 4, which is disseminated to abdominal organs, including thoracic organs like lungs and brain. So usually the lower stages is confined to the uterus, confined to the cervix and the pelvis. And then when we're talking about stage 3 or 4, we're talking about distant metastasis, including the brain and the lungs and the liver.
Mm. How treatable is cervical cancer when people get, or when women get treatment? Is there a big chance of survival?
It all depends on when it's diagnosed. So you mentioned at the beginning of the talk that there were a lot of patients that unfortunately weren't able or couldn't survive cervical cancer. And that used to be most of the times because by the time it was diagnosed, it was already too late. It had spread all over. But nowadays we have more access to healthcare. The patients are more cognizant and more aware of this problem, and they are coming forward to the doctor more frequently. So I would say nowadays cervical cancer is the vast majority of the patients survive because it's being diagnosed earlier. And also we have the HPV vaccine that has been approved all the way to 46 years old in men and women. And that also has decreased tremendously the incidence of cervical cancer.
Why 46-year-old?
It is indicated in the early ages, 9 to 12, but it can be given if a patient didn't get it at the time that was uh, normally recommended, they can still get it all the way to 46 years old.
Mm-hmm. Are there any side effects to the vaccine?
So usually local effects of the injection, a little bit of soreness in the injection site and redness. Most of the times that is just what the patients experience. And yeah, that's pretty much as far as I'm concerned.
Mm-hmm.
And as long as the patient doesn't have any allergies to components of the vaccine.
Okay. Where someone in our audience is asking if you could please repeat what's the age for the HPV vaccination.
9 to 12 years old.
And then all the way
And
to
they are being
46 if
given
you
them
didn't get it.
in the schools. So I've had a lot of patients that I have asked them if they got the HPV vaccine, and they are administered their recommend in several schools. They are being given at that time frame.
Yeah. Now let's talk again about the PAPs, Dr. Parra. Until what age should a woman do PAPs?
So the recommendation is to do pap smears all the way to 65 years old. If the patient has had a lifelong history of normal pap smears and never had HPV or any abnormality, then 65 years old is considered completed cervical cancer screening. However, if the patient has had abnormal pap smears in the past, and perhaps she has had HPV diagnosed as well, we need to go anywhere from 10 to 15 years after her last abnormal pap smear. So sometimes we have patients that are 70, 75 years old, and we're still doing pap smears because there was a remote history of an abnormal pap smear in the past. But if everything has always been normal, always and never been positive for HPV, then at 65 years old, we can complete cervical cancer screening surveillance.
Mm-hmm. Is the same PAP done to every woman, regardless of age, or if they're sexually active, or if they're afraid of the PAP procedures?
Yeah, so like I said earlier in the talk, when a patient is younger than 30 years old, we typically collect cytology only. And then after 30 years old is with HPV. Now, in patients that have never been sexually active, for example, we understand that it can be a little frightening and we don't want to cause pain with the speculum. So oftentimes we can still obtain a pap smear with this small brush blindly. So without putting a speculum, we can try and obtain that. And I've have success doing that.
Yeah. Oh, that's very good to hear.
And this is in an effort to, patients that never been sexually active. We don't want to disrupt any part of her anatomy with the speculum, which can be a little uncomfortable.
Hmm. Yeah, especially if you're younger. I think that's really good too. Yeah, and somebody's saying here, yeah, that's great news. Yes, I agree. That's really great news. Where can we get the HPV vaccine? You mentioned schools, obviously, maybe at the OBGYN office. Do primary care
Right. So
providers also give it to you?
primary care providers should be able to provide it. They should be able to have it in your pharmacy as well, in Walgreens and CVS's. And we do have it in our offices, in both of our offices in Highland Medical. It's a wide, right now, most of the offices have this vaccine available. Even we know we have partners in Women's Way, for example, which is a midwifery office, and they also carry this vaccine for the public.
Mhm. Now, I think this is my last question about PAPs, but how do you prepare yourself for a PAP? If I'm going to have a PAP tomorrow, is there any foods that I need to eat? Can I take a shower? Do I need to be fasting? What about intercourse? Any prep to have a good PAP smear?
So your diet should not change or affect your pap smear at all. Like you would, like prepare normally, like how you would for a doctor visit. But intercourse, it's a little debatable. We can definitely see sometimes a little bit of inflammation on the cervix after intercourse. Um, Not so much that it could affect the pap smear, to my knowledge, but preferably, usually we ask the patients, hopefully not to be on during their period, because sometimes we can have abnormal pap smears when they are on their period. We can pick up some uterine cells that are not supposed to be in the cervix. So if the patient is on her period, sometimes we can make an exception if it's kind of like last day and there's just minimal bleeding or light spotting. So preferably not during patient's period. Um, I would say maybe 48 hours, anecdotally from my own experience without intercourse, but there's really no, I haven't read anything in the literature that said that the patient shouldn't have intercourse before her pap smear.
Mm.
But other than that, no, diet should be regular and the normal, what a patient would normally do when she's going to a doctor's visit.
And Dr. Parras, are there any risks for cervical cancer?
At risks? Any risks?
Yes, risks.
Okay, so definitely patient has been unvaccinated with HPV is at a higher risk than the general population for cervical cancer. A patient that is not compliant with her gynecological care of her gynecological visits is also at risk of having an undiagnosed cancer. Um, and radiation puts patients at risk for cervical cancer if they have any pelvic radiation for some other reason. And of course, HPV with multiple sexual partners um, puts the patient at risk for getting the HPV and at risk for cervical cancer and immune deficiencies as well, like HIV.
Are smoking and obesity any risk factors?
Smoking, definitely. So it's smoking when coupled with HPV, that is a very, very bad combination. One of the main recommendations for patients that have been diagnosed with HPV is try to cut down on smoking and hopefully stop smoking because it makes your body more challenging to eliminate the virus or clear the virus on its own. So smoking definitely should be avoided in patients in general, and it puts a patient at increased risk for cervical cancer.
How else can HPV be transmitted? Is it solely by intercourse, or are there any other ways?
Well, so far there are many different strains of HPV, a lot of different strains of HPV. Some of them are strongly associated with cervical cancer, but there are other ones that are less high risk and that they can cause genital warts and even warts in other parts of your body. So what the literature says is that HPV is sexually transmitted, but I have found HPV in patients that are not sexually active. So as of now, yes, it is considered sexually transmitted, but I think in the future this is probably going to be revised and more information will come in the future because for some reason I've had a couple of patients that have never been sexually active, and it can be even on the physical exam, you sometimes can tell whether the patient has been sexually active or not, and it's been positive sometimes. So it's a little ambiguous at this point. The literature states HPV is sexually transmitted, but perhaps maybe in the future this will change as well.
Yeah, wow, that's very interesting to learn that. And now I'm going to ask our attendees, if you have any other questions, please start writing them down. We are reaching the end of these community chats. We have a question here. Is for ages 21 to 29. Should have PAP done every 3 years, and then over 30 years and older, have the PAP and cold test with HPV every 5 years?
Correct. These are the current guidelines. So every 3 years between 21 and 29, and every 5 years after 30. Now, a lot of patients don't feel comfortable waiting 3 years or 5 years. With new technology that we have nowadays, we are able to do it every 5 years and 3 years. Before, when we couldn't check for HPV and when the technology was less advanced, I'm speaking for myself. I'm from a third world country, from Colombia. They used to do it every year. The culture was to do it every year. And now it has changed. But some patients still find it a little challenging to wait for such a long period of time. We explain to patients that these are the current guidelines. Some of them abide by them, but some of them, they prefer to get the pap smear done. And they usually say, well, if the insurance covers for it, then why not? But yeah, so we counsel the patient, we explain the guidelines, and we honor their wishes anyways. Some of them now are changing their mindset that it's okay to wait a couple more years if normal, especially if they are in a monogamous relationship, then there shouldn't be any reason.
Mm-hmm. Now, if you have a family history of cervical cancer, should you have PAPs more often than other people?
So cervical cancer is not familial, usually not hereditary. So the cervical cancer's guidelines remain the same.
Oh, that's good news, I guess. Now, is there any correlation of cervical cancer with the use of maxi pads or tampons?
No, no, there's no correlation to my knowledge, no correlation with the use of maxi pads or tampons.
Mm-hmm. What about correlation with the use of feminine cleansing products?
I would have to do a little bit of research on them, but again, I don't think that there's any exposure that would increase the risk of cervical cancer.
Mhm. Now, can we briefly talk about HPV in men? Like, do all women receive the HPV from men? Can they receive them from another woman? How does that work a little bit? And what are the health risks for men who have HPV?
Right. So in men, it's again, it is sexually transmitted. It is more common also, or more worrisome, I would say, and not more common, but it is common in men and women, both of it equally, but it is more worrisome in men who have sex with men. In this situation, usually those patients get anal pap smears because men can have anal cancer or HPV related anal cancer. There has also been described penile cancer, but the incidence of HPV related penile cancer is still very, very low. Men are usually and most of the time carriers of the HPV, and in the same way that a woman's immune system can clear the virus, it the same happens with men. Uh, Perhaps a little faster than in women because we don't have cervixes. But in a man that has a robust immune system, the body itself is able to clear the virus a little faster. For women, sometimes takes 1 to 2 years for your body to clear the virus. That's why we ask the patient to follow up every year
Mhm.
and make sure everything is okay.
So
I've been trying to look in the literature and see if there is a validated test to check for HPV in men, and really the only one that I could find was anal pap smears with HPV, just like we do a pap smear for women and the cervix. For men is anal pap smear because anal HPV related cancer in male is more common than penile cancer. There
Mhm.
has also been described oropharyngeal HPV related cancers, and this is because oral sex. But again, it is also extremely uncommon.
Hmm. Okay. Talking about men a little bit, and I'm sorry, we're kind of deviating from women's attention, but where do men go for this test? Do they go to the OBGYN, their primary care? Where should they go?
Right. So usually they go to the primary care doctor, and there are special clinics for STI screening for men who have sex with men. Uh, men who have sex with women don't usually get anal pap smears. It's not routine standard of care.
Mhm. Can young men receive the HPV vaccine?
Yes, and it's recommended as well for men and women
Okay,
in the same time frames.
okay. And another question about men. When should the anal pap smear start for men?
Well, this is a little bit outside of my area of expertise. It There are clinics and communities that they have special clinics for men who have sex with men to prevent HIV infections, and they provide prep medications for them. But I would believe that I think the last time that I checked, if a patient is HIV positive and it's men who have sex with men, they should have anal pap smears every year.
Mm. Yeah, as a matter of fact, I'm writing in the chat the information for the Jacobs Family Wellness Center that it's also part of Montefiore Nyack. I'm writing down the phone number, and we do all those testing for men there. So if someone is interested, they can call at this number and ask for an appointment. But all these anal paps and everything is done there. So that's probably a good resource to share right now. And another question here is, what are the typical barriers for screening for HPV in the community?
Uh, I think the lack of knowledge. So education, I think, is the primary barrier for cervical cancer screening because the patients don't know what it is. They don't know when should they start, and then healthcare access. So primarily education and healthcare access. We're lucky in our community in Rockland that we have a very, very excellent um, amount of patients that they come forward every year
Mhm.
for their pap smears. But the two primary challenges or barriers I would think is education and healthcare insurance.
Yeah, yeah, I know that health insurance is definitely an issue for a lot of people because not every health insurance is going to cover all the testing, but
No, and a pap smear out of pocket is almost like $900.
it's unbelievable. I mean, something that can save lives, but we're not gonna fix that right now in these community chats. But
It's a
yes,
work in progress, yes.
it's work in progress. Yes.
But yes, everybody who have friends, everybody who has, family members, they should encourage them to see their gynecologist once a year. And in our office, for example, for patients that don't have insurance, we can provide, I think we have in partnership with either LabCorp or Quest Diagnostics, that we can provide some sort of discount for the pap smear itself. So what we're trying to improve the access to cervical cancer screening.
Yes, most definitely. And as a matter of fact, at Montefiore Nyack, hopefully next year we're going to start offering some free screenings, especially for people who are unsecured or their insurance doesn't cover for this testing. So that's good news. Hopefully coming next year. Same for colonoscopy, skin cancer, and we currently have breast mammograms,
Right.
like free mammograms. Yes. So, trying to bring the services that our community needs, more often. Uh, do you know of any resources for education where people can go and get more information about this important topic?
Definitely the ACOG, the American College of OBGYN webpage has a lot of patients resources and patients brochure with, like in layman's terms, they explain about cervical health and cervical cancer screening. So the American College of OBGYN ACOG webpage,
Mhm.
there is a section for patients.
Okay. I'm not sure if I'm understanding this, but we do cervical cancer screening at Montefiore. I guess I know we do it, but is it free? I'm not sure. So if you can answer, if you can help us with this, that'll be great to put it out there for people to know.
Yeah, no, the question was not the question. That statement was for patients without insurance,
Yeah.
that are not pregnant, and that yes.
Yes. Okay. Well, thank you so much. This was a lot of questions and you answered them all. So thank you so much for that, Dr. Parras. And hopefully next time we get to see you and you don't have to be driving. Oh, we're seeing you now. What a surprise. That's
Yeah, it's
nice.
okay. So, good news, I only got a warning, no ticket.
Okay. Did you say you were a doctor?
No, no, no. I think I have a clean record, so I think he was merciful.
Oh, okay, that's good. I'm happy to hear that. I
Thank
was
you so
gonna call
much.
you
I
afterwards to
apologize.
ask you.
The hopefully the next time I can plan a little better and maybe have some slides for you guys so that you can see. Um, but thank you for having me.
Yes, no, it's such a pleasure to have you here. Thank you for explaining everything so easily. It's really good to understand more about this. And to our attendees and for some of you who are going to be watching the recording or listening to it, I really encourage you to go and have your PAPs done every year. I'm not going to say I like them. It is uncomfortable. You have to make a medical appointment and all of that, take some time off work or your busy lives. But I think as scary as a PAP could be, it's a lot less scary than a cancer diagnosis. So I'd
Absolutely.
rather deal with that once a year than having to hear, 5 years from now that I should have done something earlier. So think about that and, call your OBGYN for your appointment and join us next week. Next week, we're going to be talking about, we continue, I think, with the topic of cancer, and we're going to be talking about, let me see. Oh, no, different. Acute rehab, like what we need to do, what acute rehabilitation is, and what it encompasses, and when it's going to be used. So I'll see you next week for that. And Dr. Parra, again, thank you so much. I mean, I admire you. You were driving and then answering all of our questions and all of that.
It's
So
okay.
that takes a skill, and dealing with the police on the other side.
It's okay. No worries. Everything is good. I'm
You are
happy
doing a
to
lot.
help.
Thank you so
Happy to
much.
help. Thank you very
And
much. Have a nice day.
you too. And thank you to all of our attendees. Be well. Bye-bye.